My name is Anish, and today we're going to talk about hip flexor tendonitis. Now, hip flexor refers to the number of muscles that are in this area called the hip flexor muscles, and the tendonitis refers to the parts of these muscles that attach to the bone. And so what happens in hip flexor tendonitis is that these tendons get inflamed by overflexion or some other mechanisms that we'll talk about. And because they have less blood flow to the area, they actually take a little bit of time to heal. So the way this lecture is structured, we'll talk about the different causes of hip flexor tendonitis. We'll talk about the symptoms that patients often present with, how we would diagnose it, and the treatment options that we would go through. So let's go ahead and get started. So the causes of hip flexor tendonitis have a common theme, and the theme is overstretching of the tendons or the muscles. So let's walk through this. Poor flexibility. When you're stretching, you might be causing an overstretching of that muscle or that tendon, and that could cause these tears. If you're growing too fast, you might also be causing overstretching of these muscles. Too much exercise too soon can also cause overstretching. And trauma can also be another cause of hip flexor tendonitis. So what are the symptoms that a patient might present with? Well, it usually will occur, the pain will usually be on the top part in the front of the hip, so over here, and that's because that's where most of these muscles attach. The pain will also be worse if the patient lifts their knee in this kind of direction, and that's because that's hip flexion, and that's going to involve the muscles that are strained. Patients will often find it worse if they're running or they're sprinting for the same reason, because they're causing flexion of that knee and re-aggravating those muscles that are torn. So how would we diagnose hip flexor tendonitis? Well, there usually will be a pain that occurs when the patient is flexing their hip. The other thing that they'll notice is tenderness of the ASIS point on the front of the hip. The ASIS stands for anterior superior iliac spine. And that's the part of your hip that you can feel kind of lower towards your groin area. That is where most of these muscles attach, and so it's going to be tender over there. There's also weakness that happens. X-rays can also help with the image, with the diagnosis. We want to be concerned about an avulsion fracture where the tendon actually takes some bone with it. You can also use ultrasound and MRI in more severe cases. Now, how would we treat hip flexor tendonitis? Well, there's a number of modalities, but usually we like to start with conservative treatment. So we want to avoid aggravating activity. So avoid running. Walking may be okay, but you don't want to do anything that requires a lot of flexion of your hip. You want to ice 15 minutes up to 3 times a day. That would be really helpful to help reduce the inflammation. Indoor cycling and spinning are also really helpful. So as you can see, you're not over flexing, but you're giving a nice little stretch to those tendons to help increase that blood flow to that area. And some medications that we could use are some creams that we can provide. There's some anti-muscle spasm drugs that we can provide, like Flexeril or Soma. Some anti-inflammatories would be really helpful, like Aleve or naproxen. Some pain medications, and these are more used in severe cases, would be tramadol or Norco. And then there are some other treatments. So there's some home exercises and physical therapy that they can do. So as you can see, this provides a nice little stretch to those flexor muscles. Some injections can be done if the patient is still experiencing pain and has tried a number of different modalities. And then surgery can also be an option, and that can be helpful in terms of if there's a really large tendon tear and it's not getting better. So that's about it for this lecture. I hope that was helpful. If you have any questions, please feel free to ask me or Dr. Hizan.